and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show for Friday, November 16th, 2018. We're going to talk a lot about orthopedics again on the program tonight, but we're going to talk about a little bit more about the spine than we've got into recently. We have Dr. Jonathan Hyde. He's from Miami Spine Specialists. And I just want to welcome to the program Dr. Hyde. How are you doing this evening?
Doing great.
Thank you, and thank you for making the drive up to our Boca studio. But you were telling me you have patients from all over South Florida, so this isn't out of the norm for you to make the drive up from Miami.
Oh, it's not a big deal. We have a little bit of traffic today on I-95, but nothing crazy.
Thank you, and thanks again for taking us on this adventure in health. Tell the viewers and listeners about what you do, what your medical specialty is.
Well, I'm an orthopedic surgeon, but my particular specialty is spinal surgery. So I've done some what we call fellowships in spine surgery, and I trained up in New York, but I also did spine fellowships in Texas and also in Britain, and I've been in South Florida since about 1999.
Well, we're glad to have you again. So spine surgery, I know a little bit about the fusion spine surgery because I think that's the kind of more of the latest and greatest, and we hear a little bit more about that. But take us through different surgical options used today for the spine, because it's not something that I've had many experts on to talk about. I mean, we talk about orthopedics a lot, but not too much about the spine, so it's great to have you here.
Well, most patients don't need spine surgery, people with back pain. Most people get better with physical therapy, and sometimes we do injections as well. So part of what I do is also the conservative care, because part of my job as a surgeon is to try to prevent people from having unnecessary surgery. But when we need to do surgery, we have multiple different options. It depends upon the pathology that's there. So, you talk about spinal fusions, and we of course have what we call minimally invasive spine fusions. We have the open fusions, but most of the fusions, if I have to get to that point, even if it's a larger fusion, I use what we call those lesser invasive techniques, because we want to really make sure the patients get the best long-term outcome without putting them through really bad, what we call morbid operations with a lot of blood loss. So we try to minimize blood loss and get the maximum functionality of the patient. But as far as newer things that we're doing, we're looking at different alternatives. And a lot of the alternatives deal with our more understanding of how back pain actually is. And because of that, we're able to do other things other than fusions to control back pain.
Nice, and you did mention non-surgical approach, and I always find that interesting early on, because we think of orthopedic surgeon, the first thing the general public thinks about is surgery, obviously, but you kind of came right away with the non-surgical approaches. You talked a little bit about physical therapy and other prescriptions that you may make for certain cases. So someone comes into the office and you look at the case first as non-surgical approach.
Every patient, I want to first think about their holistic approach, what's going on with those patients. And we need to understand what type of work they do, what their functionality, are they into sports, are they more sedentary? But what we want to understand is how they got their pain and how we can get rid of the pain. And if surgery is one of those options, it may be discussed, but we try all the alternatives before we get to that point.
That is great to hear. I'm really glad to hear that. We're here with Dr. Jonathan Hyde. He's from Miami Spine Specialists on the program this evening. Does it differ, different types of treatment, non-surgical versus surgical approaches? Does it differ with, you mentioned like athletes, the weekend warrior versus like the baby boomer population, which I'm told is the fastest growing population in the U.S., and geriatrics. Is there a totally different approach for the different age groups that you treat?
Well, the approach in general is the same, because we're still going to do the physical examination, we're going to do the history, we're going to understand what's going on in the right patient. We need to get the MRIs or CAT scans or bone scans. But in the different population groups, there's different pathologies that start coming up. So the younger patients, you'll see more of the disc herniations, you'll see some orthopaedic changes to the joints. We call that facet arthropathy. Sometimes we'll find stress fractures and some instability secondary to what they've done. As you get older, we start seeing more of the arthritic changes. We start seeing what we call the spinal stenosis patients, the patients who have difficulty with walking. But also we have the patients who develop osteoporosis. And when they develop osteoporosis, we have to look at their non-operative management, but also these patients come in with fractures. And they're very painful. And it's amazing because, we're here in Florida, people think, oh, well, it's all geriatrics here. It's not just geriatrics. And I sometimes, joke with my patients who are in their 70s that they're pediatric to me, because I really see patients who are in their 90s who are extremely well active, but then they get a stupid osteoporotic compression fracture and it changes their lives. But with some of the technologies that we've been doing now for almost 19, 20 years, we're able to control their fractures with not just pain medicine, but we'll do some injection techniques such as vertebroplasty or kyphoplasty.
That's nice to know, and I'm sure the demographic down near you is changing a lot too, because Miami's changing so much. It's really going
There's a lot of changes, a lot of building, and
a lot of people coming here from South America, etc. as well. And I'm going to get into that because I know you have a lot of patients that come from outside of the U.S. So I did hear that about you through the grapevine. But I'm going to ask that in a bit, though. The reason I wanted to ask you about, different treatment plans for different age groups is because we have a lot of, viewers on this show. Listening and viewing online is normally are millennials or young adults, and adults male and female 30, 65 years old. And then the baby boomers, geriatrics, I think that's more of our listenership on the AM and FM radio. So in my few years of doing this, that's kind of what I've came up. That's why I wanted to ask you that question. We're here with Dr. Jonathan Hyde. He's from Miami Spine Specialist. And if you have any questions, he'll be here till 6 o'clock. The number's 1-888-565-1470. Where is your practice located? Are you just in the Miami area?
My practice location is on the site of Mount Sinai Medical Center, and that's my main office. And at one point, I used to have offices in Coral Gables. I had an office in Aventura, but when the practice became busier, it's easier to be in one location, and it's nice because my office is right off the highway. So my patients who come up from Key West can see me. My patients who come down from Jupiter and Delray can see me. Even my patients from Fort Myers and Naples. Plus, you're talking about international. We're down the road from Miami International Airport, so it actually makes things a lot easier for at least seeing these types of patients.
What's the best exit right there that's closest to you that you were mentioning?
Well, we're right off of 195, off the Julia Tuttle. So you just take I-95 to 195, and it goes right to the Sinai campus. And we're located in actually a beautiful building. It's now about 9 years old, called the Golden Professional Building.
Nice. I just brought up here, great website. I got a lot of info for the show from miamispine.com is where you can find more information on Dr. Jonathan Hyde. Mount Sinai, I've never been to that hospital, but I've seen pictures of that's the one right on the water.
Yes, and my office is also on the water. We have beautiful views, yes.
Is that Biscayne Bay there then?
Right on Biscayne Bay, and we have therapy on site there, and it's beautiful because we have people who work out, and it's nice to feel like you're actually in Florida even when you're seeing your doctor.
Yeah, I think that says a lot, and being comfortable, already coming into the doctor. If it's in a nice place, that seems to help out. Maybe I think patients who may be nervous about seeing a spine specialist for the first time. I think that would help a little.
Well, it's a scary feeling. Oh my God, I'm going to be seeing a surgeon who actually operates on people's spines. It's kind of crazy. Plus, sometimes when I see patients, I have patients who have very severe problems that I need to spend extra time. So, if it's a longer wait, patients will look out the window and there'll be a manatee out there. You'll see dolphin out there. So it's actually kind of like my own little personal aquarium out there for my patients.
That's nice. It's Miami Spine Specialists at the address right here, 4308 Alton Road, Suite 830, Miami Beach. Dr. Hyde's number is 305-532-0065, or like I said, great website, miamispine.com, and we'll give out that info a few times during the program. I did mention before that you have seen, I've seen it talked as medical tourism in a way, in a good way, influx of patients from outside of the U.S. So if you have an ailment, first thing people obviously do nowadays is Google, but then friends and family help out resources. They talk about who's the best for certain things. You're a super specialized orthopedic surgeon working on the spine. So do you get a lot of patients from the Caribbean, South America, as I heard through the grapevine? Well, a little bit?
Yes, I have. And it's a lot of it is word of mouth. I mean, we have certain physicians that will refer to us because they know of the work that we've done on patients that we've taken care of. But it's interesting. It's even how my patients are here. A lot of it is not necessarily from doctor to doctor referrals. It's their family members and their friends. And so you take care of a prestigious family in a certain location, and they start sending their friends, and you start seeing second opinions, etc., and eventually you develop a nice international referral base.
That's nice to hear as well. I got about less than 2 minutes. I want to ask you again a quick question. You mentioned you did a fellowship before. Can you just tell us your medical school, I guess, residency, internship, and fellowship?
Sure. Well, I'll start off undergraduate. Undergraduate was at Cornell University. I am a native New Yorker, and when you come to my office, you'll see a whole bunch of New York art that we like to have, so you feel like you're at home if you're from New York. But then after my training in New York, my residency was at Long Island Jewish Medical Center, again in New York. And my first fine fellowship was at the Texas Back Institute in Plano, Texas. Then I did actually a second fellowship at the University of Nottingham in Britain.
Oh, wow. Great Britain.
Yeah, that's very interesting.
That is very interesting.
National health care, and you learn a lot about how medical care is done outside the United States.
Yeah. New York City, Texas, and Great Britain. That is great medical school education and training there as well. We're here with Dr. Jonathan Hyde from Miami Spine Specialists, miamispine.com. They're located at 4308 Alton Road, Suite 830 in Miami Beach. Dr. Hyde sees patients from Jupiter, Key West, and beyond. They all find him as the specialist in the area, so check him out. If you have any questions, 305-532-0065. Dr. Hyde, we're going to take a quick break, and on the other side, talk a little bit about where you do surgery at in South Florida on the How to Stay Healthy show.
County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back. Thank you, South Florida. And welcome back to the How to Stay Healthy show. We're here with Dr. Jonathan Hyde from Miami Spine Specialists, miamispine.com. I wanted to ask you, when you do surgery, so your location is right next to Mount Sinai, so is that one of the places you do surgery, and are there any additional areas that in South Florida that you do surgery at?
Yeah, for hospitals, I'm on staff at Mount Sinai. That's my main hospital, but also I'm up at Aventura Hospital Medical Center, and I'm also at Baptist Doctors Hospital, which is a very strong orthopedic hospital. But I also do a lot of outpatient surgery now at the Doral Surgical Center, and it is very nice to do that because now we're moving a lot of these complex surgeries, and we're able to do them as an outpatient.
Because the thought is to move the patient get them back outside of the hospital as soon as possible. Get them back home into maybe if home care, if that's prescribed, or out of the hospital setting as soon as possible.
Well, we all know that hospitals are great to have surgery, etc. But we find that when we do patients more outpatient, they rehab much better, and they actually have lower infection rates and their complication rates go down.
Okay, that's
why we're trying to do it this way. Yeah,
and that's then Doral, that's Surgical Care Associates.
Well, Surgical Care Associates is one of the partners. Yes.
Okay, got it. And I believe they have a surgery center here in Boca Raton as well. I think we're bringing on some doctors in the future, so you're going to want to tune in. You can always find these shows on All County Healthcare's Facebook page, so it's All County Healthcare INC, or on their website, allcountyhealthcare.com. There's a whole library of the shows if you want to go back and find this one. I got the $1 million question here that everyone wants to hear. Why did you decide to become an orthopedic surgeon?
Wow, that's a big question. Actually, truthfully, when I went to medical school, I was actually thinking about going into plastic surgery. Well, I hurt myself skiing when I was in high school, and I had to have some plastic surgery to fix my nose. It's not too bad. But
I wouldn't even been able to tell, to be honest with you.
Yeah, well, that's why a good plastic surgeon. Yeah. But
it's a good doctor.
When you're in medical school, you start learning about other aspects, and I started doing research in orthopedic surgery. So my research was in osteoporosis, and there I'm doing osteoporosis work now too. And I fell in love with doing all these other aspects, and that's how I ended up going in orthopedics. And as far as spine surgery is concerned, I went into it because I found that even as a resident, a lot of doctors really don't understand back and neck pain problems, and I really wanted to understand. It's very difficult doing what I do, and I wanted that challenge, and I think by helping a lot of people with really complex problems, it's been very satisfying.
Do you have somewhat of an engineering mind as well? Because I've talked to a lot of orthopedic surgeons over the years, and they say, some of them say I could have been an engineer. I have that type of mind. Some of them say other things. Do you have that type of, did you enjoy building things? Did you enjoy taking things apart? I mean, is that a prerequisite in a way?
Well,
looking back,
if you look back, I love Lego. I love my erector sets, and playing with, all those things. And I was a cyclist, so I used to take apart my bicycle, put it back together, and about 1,000 little pieces. But, I was, as a major in college, I was actually a genetics major. I really liked, cell development and looking at genetics and how development was. But it's interesting when you're going to orthopedics and you go through medical school and you learn all about different systems, you really don't learn much about the musculoskeletal system. And when you're a resident in orthopedic surgery, you're basically taking a crash course in engineering. And it's funny because my youngest son is actually right now a sophomore up at Cornell doing biomedical engineering. He's learning everything that I would have loved to learn, and it's amazing that he's learning things that I had to take a crash course on and getting that depth.
That's nice to hear. We're going to need biomedical engineers, very important field for the future. And you said both of your children are at Cornell, correct?
Yes, they are. Yeah.
Nice.
Yeah.
That's
nice.
great.
I love it. It's fantastic.
It is a great school, an Ivy League school. We should mention Cornell University. I haven't been there, and I know it's in New York. Is it located in New York City?
Well, the undergraduate campus, the original campus, is in Ithaca, New York, which is upstate New York, which right now they have a lot of snow. But the medical school is downtown in Manhattan, and they actually just opened up a brand new campus on Roosevelt Island called Cornell Tech.
Okay, and then where you did your residency, Long Island Jewish, that's in the city as well?
That's in the city, and when I went there, it was part of Albert Einstein College of Medicine.
Very busy hospital.
Very busy hospital.
So you saw it all as a resident.
Well, that's why you go to a good program for residency, so you learn about all these different pathologies.
And you train. Yeah, that is great. Well, we're happy to have you as an orthopedic surgeon here in South Florida. MiamiSpine.com is the website. Check it out. It is a great website. I've been on here all day looking around, and yesterday. It's Dr. Jonathan Hyde is from Miami Spine Specialists, Back Surgery Miami. They are at 4308 Alton Road, Suite 830, Miami Beach. Their number is 305-532-0065. Patients from across South Florida, Jupiter down to Key West and beyond to come to see Dr. Hyde there for his expertise in spine surgery and orthopedic surgery. I have to ask you, is orthopedic, I see it spelled, and this is another question. I kind of think of the general public that's listening. Why are there two different spellings? Orthopedic, the Latin way with the AE, which you use.
Yes.
And that's on your board certification as well, I saw.
It is, yes.
Versus orthopedic, the English way. So why did you choose to use the AE? Some doctors use the English way.
Well, it's more the formal way of doing it. In fact, when you look at the American Academy of Orthopedic Surgeons, which is our organization that once you become board certified, you become a member of and a fellow of, they spell it the original, Latin way with the AE instead of just the E. So it's really more the proper way of doing it. And there are a lot of doctors out there who say they are orthopedic doctors, but they're not orthopedic surgeons. So it's kind of the way that we really make sure that the public understands that we are the real orthopedic surgeons. And of course, orthopedic is basically out of pediatrics. So it's musculoskeletal pediatrics. And so there's a lot of elements as children, and it's one of those things that we spend a lot of time during residency learning. So it's a whole gamut of musculoskeletal ailments that we treat. So not just surgery, but we do the non-operative and we do the full surgery.
Thanks for explaining that. I've always wanted to ask that, and I had some time today to kind of look it up, and I'm glad I did ask you. And then the first thing I noticed was Dr. Hyde is board certified in orthopedic surgery, and that is the spelling, the AE. So you have another doctor in your practice as well?
Yes, I have a very nice pain management physician who's actually a doctor certified in physical medicine and rehabilitation, and that's Dr. Daniel Rivera Buscaglia. And he basically works in the office. He'll do some hospital consults, but he does a lot of the pain management techniques because I just can't inject everybody and do all the non-operative management myself. So he'll do chronic pain, he'll do acute pain, and he'll do a lot of the different procedures in the office. And we're able to do a lot of those pain management techniques and really help patients. It's nice when a patient comes in and they're hurting, that they can walk out of the office feeling better.
Yeah, and that's that non-surgical approach we kind of started with. We're going full circle here. And I'm looking on the website now. Dr. Rivera specializes in interventional pain-relieving techniques. So that is great. That's what you just explained as well. We're here with Dr. Jonathan Hyde, MiamiSpine.com. Number's 305-532-0065. What are your hobbies and passions in life outside of medicine? You got two kids at Cornell, so that's
well, I try to keep up with that, and I do some work with the Alumni Association. But besides that, I ski, and I love boating, and those are nice passions that I've had for years and growing up, and especially living in South Florida. We have so many options to enjoy and do things down here. So I like that, and play a little occasional golf. I'm getting into Top Golf now, which is kind of fun.
Yeah, I want to get down there. You guys have the Top Golf down there.
Yeah, we have two of them now. There's one in Miami Gardens and one in Doral. And, of course, unfortunately, golf and tennis are not necessarily the best sports for golf, but just like every doctor, that's what we do sometimes.
Is that because the overuse of the same motion over and over?
It's the rotation.
Rotation.
So it's when they have racket sports or swinging sports, there's rotation, and it puts extra stress on your back.
Well, no, that's good to know. Yeah, I am. I'm actually from Jupiter originally, so I enjoy boating as well, and golf is really big up there as well. When you go skiing, do you go up to the Northeast, Colorado, or around the world when you get a chance?
Well, we talked earlier about the plastic surgery. That was when I was a teenager and up in New York, and that's why I got hurt, because it's all ice, unfortunately. So I'm able to go to Colorado. So Colorado is where we take the kids during the winter.
Nice.
So typically, unlike last year where we had bad snow, but usually it's nicer snow, so it's a good experience up there.
Yeah, one of my friends out there, they just started opening the resorts, so I just saw that. He just posted that. Well, thank you so much for coming on the program and explaining, orthopedic surgery and the specializing in the spine to us this evening. You're always welcome back, and we'd love to have you on in the future. That's Dr. Jonathan Hyde, MiamiSpine.com, and we'll see you next time on the How to Stay Healthy show. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.